I'm here at Spring Hill Medical Center with Dr. Wiley Christian. And Dr. Christian, you have me hooked up to some interesting devices. What exactly is this?
This is biofeedback. It's a way for us to monitor muscular activity to teach patients to do specific exercises that we want them to perform.
Okay, now I notice this is connected obviously to this computer program with this dolphin. What am I attempting to do with this?
Well, with biofeedback, what we're trying to do is get you to see that the effort that you're giving is effective. So in this instance, if I have you raise your wrist and you contract the muscle as I've instructed, you see the dolphin go up. Right. Yeah. And that's your confirmation that you're doing the exercise that I wanted you to do, thereby getting a better result than you may have gotten otherwise. That's
pretty neat. Now, your specialty is urinary male incontinence.
Correct.
What exactly is that?
Well, urinary incontinence is basically the loss of voluntary control of your urine. And there are many ways that this occurs. For men, with the new advances in prostate surgery, it's fairly prevalent after that surgery. There are other ways to have urinary incontinence, which include urinary tract infections and blockages. But from a physical therapy standpoint of view, the majority of the patients that I see are in after prostate surgery and experiencing some lasting urinary incontinence, which usually is short-term after that surgery.
Now, obviously that is a topic that not many men are going to want to discuss openly, but when they come and seek treatment, what exactly is this device that we've hooked up? Because you told me this can be used for therapy with that. What exactly will the patients have to do with that?
This allows me to educate the patients on how to do the specific exercises for urinary incontinence, which are widely known as Kegels. Many will go to a physician's office and get verbal instructions, but it's very difficult to near impossible to show. So with biofeedback, I'm able to illustrate to the patient that they are doing the exercises the way that I want them to, when I want them to, so they'll get a better result. As you can see, this is a tangible means by which they can see their effort through biofeedback as opposed to going home and doing their own creative exercise, which oftentimes is incorrect.
And this way you're supervising the entire thing the whole time they're getting the treatment. Now, what are some good bladder habits to prevent seeing incontinence?
We all need to be sure that we consume 4 to 6 glasses of fluid a day. I want to avoid or limit alcohol and caffeine whenever possible. We certainly want to urinate when the urge occurs. Try not to practice going to the toilet just in case. And of course, with the water intake, the problem there is a lot of individuals believe that if I drink less, then of course I'll urinate less. And the problem is they get dehydrated. So we aggressively encourage them not to do that because of the health consequences. And of course, we all need to have an adequate amount of fluid every day.
Now, if someone thinks that they're suffering from this, what should they do?
Should seek an evaluation from a physician. This problem could occur from a number of reasons, which include urinary tract infections, which need medical attention and medication. Most often when I get the patients, they've had the surgery. Ordinarily, the problem goes away fairly fast, but I get the ones that months and months later, they're still wetting themselves, and of course, that's a very frustrating, dehumanizing, and embarrassing problem to go through. Ironically, we had a patient who called during Mardi Gras and said that he wanted some help because he wet his pants when he drank too much. And I said, well, that's not a urinary incontinence problem, it's a drinking problem.
Well, Dr. Christian, we appreciate you talking about this with us today. And if you are suffering from urinary male incontinence, please make sure you contact Spring Hill Medical Center for an evaluation today. And Wiley Christian, the staff here, will be able to help with physical therapy.
Absolutely.
Thanks for being on the show today.
Thank you.
Now, to find out more information about this and to get in touch with Dr. Christian at Spring Hill Medical Center, just go to our Studio 10 webpage on fox10tv.com. You'll find lots of information posted under the Healthy Living tab, and we'll have more Studio 10 coming up for you after you see this.